Good morning, everybody, and thank you for joining Representative Houlihan's telephone town hall focused on the coronavirus COVID-19. I want to let everyone know that if at any point throughout the call you have a question you would like to ask the Congresswoman or one of our guests, please press *3 on your phone. Again, press *3 at any point throughout the call, at which point you'll be transferred to one of our staffers who will enter you into the queue and take down your question. We're going to do our very best to answer all of the questions that are addressed today, but if we are unable to get to your question live during our town hall, we will have someone from Chrissy's office reach out to you within the next 48 hours to help answer your question. So on the call today, we have obviously Representative Chrissy Houlihan, and we are joined by Dr. Benjamin Abella, the attending physician and vice chair of the Department of Emergency Medicine at Penn Medicine. So with that, I would like to hand it over to Representative Houlihan.
Thanks, Connor, and thank you everybody who has joined us on this call. This is, I think, our 11th or 12th town hall since coronavirus has hit our area, and I'm grateful for the opportunity to communicate with you as well as with Dr. Abella about what's happening in our area and in the nation at large. First, before we begin, I would love to give you a little bit of an update on what's been going on here in Washington, and I'm actually sitting in Washington right now, having just ducked out of a foreign affairs meeting. We're here as well for votes, and I'll go over a little bit of that as well. So in the last several months since we've been sheltering in place largely, or the Congress has been quite busy, I've helped to pass 4 different bipartisan stimulus packages that the President has signed. And among other things, these bills have established a variety of programs. One, which is the Paycheck Protection Program, which is about small businesses. Another, which increases access to testing, funding for vaccine research and development, and of course, supporting our first responders and healthcare workers, and much, much more. So these 4 bipartisan bills have formed the response, the federal response thus far to this pandemic. And as you probably are aware, the Senate side is right now hopefully working on their response to our HEROES Act, which was passed here on the House side weeks and weeks ago. We are also working here in our office to establish a National Public Health Corps through a bill that I've introduced called the National Public Health Corps Act of 2020. This is a bipartisan bill, and it would create a new branch of the National Service Group, the National Public Health Corps, within the Corporation for National and Community Service, or CNCS, which would allow us to mobilize service-minded individuals who would join in the COVID-19 response and fight to be able to support already existing public health needs in communities across the country. This Corps would help to fill the personnel gap in our current healthcare sector to help us ramp up testing, contact tracing, and eventually distribution of a hopeful vaccine. So I'm very hopeful that that sort of legislation, that sort of national response will be part of the solution. And as we know, we really are struggling to have a national response in this area. I've also helped to introduce the Opportunities for Heroes Act. And importantly, this act would provide $25,000 of either student debt relief or credit towards education, or even towards the purchase of a home for essential workers like nurses and firefighters and police officers and grocery store workers, in recognition of the service that this group of folks have provided us during this really intense time of need. And I've also led an effort to secure waivers that have enabled the Pennsylvania Food Distribution Network to be able to provide more than 2 million households and 5 million individuals with 64 million pounds of food over the course of the last few months. And I've helped obtain a waiver from the USDA that permits school districts to be able to be more flexible in the way that they distribute food to thousands of children who are in our area who receive free and reduced price lunches twice a day. I've also fought for more federal support for state and local governments, including increasing the flexibility and timeline of use for those funds. As we've known, a lot of the state and local municipalities here in our area have depleted their funds, rainy day funds, in response to the COVID virus, and they also have lost a lot of revenue because of the fact that we were all sheltering in place. And I have fought very hard to make sure that there's more federal support to state and local governments to be able to backfill that and also to be able to compensate for lost revenue. I helped to pass the Coronavirus Aid, Relief, and Economic Security Act, which is also called the CARES Act. And this was the last historic bipartisan stimulus package that was passed, and it included a mandate to make federally backed low-interest loans and grants available for our small business communities. And that was, of course, called the PPP program. I've been meeting virtually with our community's small business owners, and I've been meeting with lending institutions to hear their concerns and your concerns and translate them back into feedback for our future legislative actions. And I've mounted an effort to urge the House and the Senate leadership to pay very close attention to the unique challenges that face what are called micro businesses, or very small businesses under 25 employees, and sole proprietorships as they try to weather this crisis. I've led efforts to make EIDL loans, the emergency disaster loans, available to our agricultural producers who were originally left out of the opportunity to access PPP and EIDL loans. And I helped to pass the PPP Flexibility Act, which the President recently signed, which allows people to use the PPP funding in different ways than it was originally designed. As I mentioned, as we came into the call, we've held about 10 virtual town halls, a little bit more than 10 since the start of this, and we've always tried to provide experts from Penn Medicine, from the Small Business Administration, from mental health providers, from educational providers, from the Library of Congress, from the FCC, and much, much more. And finally, we've also established 3 rapid response teams, which better serve our community during these uncertain times. And if you have a pen available, I can give you the email addresses for each of those, and I will give them to you at the end as well. For the small business needs of our community, you can reach my team at PA, like Pennsylvania, 06, like the 6th Congressional, .smallbusiness@mail.house.gov. Again, that's PA06.smallbusiness@mail.house.gov. If you have concerns about taxes or rebates, it looks as though there may be an upcoming second rebate as well. You can reach our team at PA06.taxesandrebates@mail.house.gov. If you have concerns or need help on unemployment claims, PA06.unemploymentcompensation@mail.house.gov. I've hosted and participated in a variety of different roundtables and committee hearings with local and national leaders, including, of course, Dr. Fauci, the Pennsylvania Agricultural Secretary Russell Redding, the Small Business Administrator Jovita Carranza, Governor Wolf, and the Secretary of Health in our own state, Dr. Rachel Levine. This is just some of the things that have been happening in the COVID environment. Also, this week, what has happened here in Washington has to do with the continuing work of the people. Last night, I helped to pass the NDAA, which is the Defense Appropriations Act. And this is, I serve as the only member of the PA delegation on the Armed Services Committee, and I'm making sure that in the priorities of the NDAA, the Authorization Act, that we are including a lot of priorities of our community. One is that we were able to pass in the NDAA some amendments that talked about the recruitment and retention of women. There is about 20% of our military are women, and we need to, of course, increase those numbers. We focused as well on child care issues, on the quality of military housing to make sure that everybody can bring their entire selves to work and knows that their family members are home and safe, and that their family members have access to child care as well. We also made sure that we were focused on our local area, which is the Sikorsky Helicopter Factory, to make sure that we're trying to keep those good-paying jobs here in Coatesville. My office also focused in our efforts on cyber vulnerabilities and making sure that we were also focused on the PFAS issue. PFAS is the chemical that's used in fire suppression. It is effective, but unfortunately it is not effective, is very harmful on people when it gets into our water supply. And so one of the amendments that my office introduced had to do with that particular issue and finding alternatives for that. We also made sure in an amendment from our office that the CDC has the funds to do its congressionally mandated health studies and to coordinate their researches to find an alternative for PFAS. And lastly, we're fighting back against the administration's efforts to cut back labor protections for the DoD. So that's a little bit of what's happening here in Washington this week. Today I'll be voting as well on appropriations bills, or the bills that allocate money, appropriate money for the government to continue to run. Lastly, in the terms of the district, we have returned thus far to date over $3 million in the last year and a half to constituents, and we have closed over 1,000 individual constituent cases. Even though our staff is, of course, teleworking and, of course, is working aggressively to combat the effects of the COVID virus and has reorganized to that extent, we have also been working on a traditional work of the government. So if you still need help with any traditional work like federal benefits, like accessing the VA or Social Security, or assisting others with federal agencies, we still are actively able to help you with these sorts of issues as well. That brings us to the next part of our conversation. I am going to turn it back over to Connor, who will go ahead and introduce us to Dr. Abella. And I think we've also been joined by another special guest. So I will turn it back over to Connor.
All right. Well, you just did it all for me, Representative. Thank you so much. And I'm going to hand it over to frequent guest on our town halls, expert Dr. Abella.
Well, thanks very much, Connor. I appreciate it. And thank you, Representative Houlihan, for having me on this call. We really appreciate your leadership and really energetic involvement in all of these issues. For those who don't know me, I'm an emergency physician at the University of Pennsylvania, where I've worked for a number of years. And I've been very involved in the COVID response, both from a research standpoint, from a clinical care standpoint. I've taken care of many, many COVID patients and so forth. And I think my charge today is to share with you some thoughts on where we are and what we can do around this pandemic in Pennsylvania and around the country. And I'm sure, as many of you know, we are not out of the woods yet by any stretch of the imagination. A number of states, thankfully not Pennsylvania, but a number of states have seen dramatic increases in cases. So I think it's important that everyone understand that we can't let our guard down. The good news is that Pennsylvania has done a very nice job of managing this pandemic. Although there has been tragedy, there have been deaths, there have been many sick people, relatively speaking, we've had pretty consistent messaging, pretty aggressive public health activities, and we've been able to tamp down the number of cases and keep it to sort of a low broil. Now, here's the key, though. We have to keep wearing masks, and we have to keep social distancing and hand washing, all of those things that make a real difference in public health. They're inexpensive. They work. By the way, soap and water work just as well as hand sanitizer. If you want to save yourself a few bucks, good hand washing with soap and water are just as effective, if not more, than using some of these alcohol-based hand sanitizers. These sorts of things make all the difference in the world. And I'll tell you that at our hospitals, we have seen virtually no healthcare worker infections, despite being amongst COVID patients, since we put in place really aggressive mask wearing, distancing, hand washing procedures. So I am firmly of the belief that these things really work. There's scientific evidence suggesting they work. And if we all continue to wear masks, the better we do with this, the sooner we can open more businesses and open more activities and return to life as we hopefully remembered it and can get back to that. The states that have not done this are really suffering, and they're going to have problems with school openings, problems with businesses opening. So it really matters that we're all really consistent with these activities. Now, one question I know that many folks are thinking about are vaccines, and when will vaccines be available? Is there light at the end of the tunnel? And I've been very involved in the research around. I can tell you that while vaccines are making progress and they're undergoing testing right now, we're almost certainly 3 to 6 months away at the earliest from a working vaccine. And you have to all remember, of course, that it's not enough to have a working, proven vaccine. There has to be a means of distribution and production and so forth. So this is why we don't have an immediate solution to the COVID problem around the corner from a vaccine standpoint, and why mask wearing, hand washing, and, by the way, testing are so crucial. So, there are many testing centers around Pennsylvania and many opportunities to get tested. And certainly if you're feeling ill, you have a cough, you have a fever, it's crucially important to understand the role of testing, because only through testing can we track folks, and we make sure we know who should stay at home and who can go to work, and it allows everyone to take better care of their loved ones and their families, knowing when to be careful and so forth. So those are some initial thoughts. I'll also tell you that because many people ask me these questions, are there drugs I can take to prevent or treat my COVID? And you may have heard a lot in the media about this, so I'll try to just make a few very simple points. Right now, there is no proven effective medication that you can take to either prevent COVID or to treat COVID in the outpatient setting. We're very actively working on these things. There are some medicines that have proven to have some benefit for hospitalized ill COVID patients. And that's good news, because we've really lowered the serious complication rate from COVID in the hospital through a number of strategies, and some of these medicines help as well. But if you're wondering if I can take zinc or a nasal spray or vitamins to prevent COVID, unfortunately there's no evidence that these things work right now. So the best way to prevent COVID is hand washing, mask wearing, and avoiding as best you can sort of crowded public indoor areas. Outdoor areas are, of course, much safer. So I think I want to keep my remarks brief, because I want to leave ample time for questions as they come through. And I know we have another person who can speak about some local public health initiatives around this as well. But fundamentally, COVID is going to be with us to stay through the fall, and we have to be vigilant, and we have to recognize that what we do impacts all of our friends, family, and loved ones around us. So, Connor, maybe with that, I'll turn it back to you, and we can continue with the program.
Thank you so much, Dr. Abella. And we are joined by Janine Kasner as well today, the Director of Chester County Department of Health. So, Janine, if you'd like to say a few remarks, you should be on the line.
Good morning, everyone, and thank you again for inviting me to your town hall. These forums remain extremely important, not only so folks understand what our leadership is doing, but also so there's an opportunity to have an open, transparent, Q&A piece of it. So thank you. I appreciate what Dr. Abella just shared. Spot on all of his comments. I second all of his comments. And just kind of maybe want to add on to what is the county's public health response look like currently. So just for, sense of context, the majority of the staff in the health department, and quite frankly, in many of our human service departments in the county, continue to respond to coronavirus from many, many different angles. The most key pieces of our effort right now are really consulting, advising, and collaborating with our school districts, helping them understand what does safety look like for their students if there is any version of in-person learning that occurs, whether it's at the beginning of the school year or it's transitioned in throughout the school year. I have to tell you, our school districts, particularly with the superintendent's leadership, they're passionate. And they are super passionate, well beyond the education of our children. They're really passionate about the safety and health of the children that we, so willingly give them every day to educate, but also their staff. So this is first and foremost on their mind. The state issued some guidance, and the health department had guidance out for them long before the state. So right now we're just really trying to get them into the final stages of their plan so they can make a strong decision, present it to their communities as well as their boards of education. I am confident that all of our school districts are heading in the right direction, and encourage you, if there is an opportunity for a community forum with your school district, that you get on and hear more. Another key aspect that continues in our response is testing. Like Dr. Abella said, testing is crucial. Testing by itself is not going to work, which is why our health department continues the integration of testing that leads to investigations of those who are positive, and that leads to our contact tracing. So all three of those work in tandem to really, first and foremost, break the transmission of coronavirus. The key piece of our contact tracing and why we ask people to remain in their homes if they're a post-contact of a positive and continue to quarantine for the specified period is so that that virus has no place to go. We stop it. The more people we can get to comply with their quarantine, whether they're a positive coronavirus test result or they're a part of the contact tracing because they are a close contact of individuals who are positive, the more we're going to break the transmission. And that's for folks who have the highest risk. And then again, to Dr. Abella's well-stated comments, the rest of us have to continue our diligence. And I know it's hard. I know it's annoying, especially as it's raining or it's hot or we have been doing this for far too long. But we really do need to keep with our basic practices that we as individuals can control. The hand washing, the face covering, the physical distancing of 6 feet, and honestly, limiting how much we are truly out and about in our communities as well as other communities. Another key element of our response, it continues to be data analysis and data monitoring. So this is what we call surveillance in the public health world, and much of that is understanding how the data and therefore this pandemic is changing and how to provide guidance not only from a public health response but from a medical response, a community response, a organization response, how to keep staying a step ahead of it. So there is, some definite trends we're seeing, and we're not unlike other areas of the nation or even within our Commonwealth. The age of individuals who are becoming positive continues to decrease. Some of that relates to, our 20 to 39-year-old population who they go to the beach for a weekend. They're engaging in social interactions in a more high-risk setting, and many without masks. So another trend is we're seeing our citizens, our residents of Chester County, leave the county for some recreation and come back, and they have been exposed or are positive themselves. Anyone can guess the most popular is from our shorelines, a number of beaches, but also we saw an uptick in the after days of the July 4th. So a lot of barbecues, even if you kept it among your families and maybe a few neighborhoods, maybe it was still under 25, it still added the risk. So those are the trends we're watching. We message differently as we see our trends change. We are seeing, fortunately, a steadying, if not decline, in outbreaks in our nursing homes as well as deaths among the older population. So those are some of the key things that we're still continuing on. We have a lot of other ancillary aspects to our response, but I'm going to end it here, and we can take questions as they come. Thank you.
Thank you so much, Ms. Kastner. And we are now going to transition to our question and answer portion. So a reminder to our callers on the line, please press *3 if you have a question so we can enter you into the queue. Again, that is *3. We've had over 2,000 people on the line, so please understand that we most likely won't be able to get to every question, but as said at the beginning, if we are unable to get to a question today, we will return your call with an answer within the next 48 hours. With that, I'm going to open it up to the question and answer portion. So our first question today comes from Robert in Downingtown. Robert, you should be on the line. Robert, do we have you on the line, sir? Okay, it looks like we have lost Robert. I will ask this question, though, as we wrote it down. The question is, how do we access the number of cases for the county? So for Chester, if you are calling in from Chester County, or from Berks County if you're calling in from Berks. So Representative Houlihan, would you like to take that?
Sure, and thanks, Connor, for that question. There are a couple different ways that you can access that information. And again, if you have a pen or pencil available, it would be good to write down. First, you go to pa.gov, and there is a dashboard there where you are able to access the latest data. It's a fairly elaborate URL, but effectively it's pa.gov/guides, like tour guide, the plural, /responding-to-COVID-19. I'll go over that again. It's pa.gov/guides in the plural /responding-to-COVID-19. But honestly, if you just go to the pa.gov website and you sort of scroll down, you'll be able to find a click-through to get you to that particular part of the URL. To give you a quick answer, though, we have so far had 4,414 cases in Chester County, and in Berks County, which is part of the 6th Congressional as well, there have been 4,889 total cases. And so that you can also access on those websites, and I look at them pretty much daily, a graph over time of the number of cases, the number of tests, those kinds of things. And I find those to be helpful. And honestly, as Dr. Abella said, in some ways reassuring, because I think that we have not tracked quite so severely as other states and areas have. And so that's the answer, I guess, to Mr. Robert from Downingtown.
Thank you so much. And again, everybody on the line, *3 to ask a question. Our next question comes from Keith in Reading. Keith, you should be on the line.
All right. Am I on?
You are, sir. Welcome.
All right. Welcome. Thank you. I have a quick question. Everybody's wearing masks. They should be. Protect the droplets getting in your nose, your mouth, or if you have the disease, spreading it. I've never heard anything, and I'm watching this 6-8 hours a day because I'm retired. I watch that since it started, this disease. What about your eyes? Unless you have a shield on, that's the only thing I could think of you could protect your eyes. But with a mask, if you get them droplets in your eyes, and I'm telling you, I heard all kinds of questions, not just from you, all the time on TV. Nobody ever asked that question. Because
would we be able to ask Dr. Abella if he could give a comment on whether or not you can in fact get the disease from?
I had friends of mine I asked, and none of them ever heard the question. They said, "You got to talk to a doctor or something," and I thought I could get through to you people. Thank God I finally got through to you this time. I've been asking thinking this over a month.
Yeah, so this is Dr. Abella. That's a great question, actually, and I appreciate you asking it. You know, the reason why there hasn't been much on the news about eye protection and why it's not talked about much is we just don't know from a scientific perspective how big of an issue it is. Now, I agree with you. For sure, droplets can get your eye, and we know that it's a possible route of transmission. So it's possible to get it, which is why, by the way, hand washing is so important. All of us, especially in the spring and summer, you know, we get allergies, we touch our eyes, we itch our eyes, scratch our eyes, I should say. So you know, you run the risk if you touch some surfaces or been out in public and you touch your eyes of getting it in there. This is also why physical distancing is important. You got to keep some distance with folks whenever possible, because if your eyes aren't covered, there's a smaller risk. Now, masks clearly work even without eye protection, because there's very good studies now that when people wear masks, even if their eyes aren't covered, they can greatly reduce the risk of infection. So that's the good news. I would say, though, that, healthcare workers, we typically wear eye protection as well these days at work. And if one wants to be extra careful, certainly wearing a face shield in addition to a mask can give you extra protection. And in many lines of work, people do that, and that's appropriate. But the thing is, the reason why we just don't know is it just hasn't been well studied. If I was going to sort of ballpark it, I would say the mask gets you sort of 3/4 of the way there, or maybe more. But there is a small risk as well through the eyes, absolutely. So that's why face shields can be important for folks, especially folks who interact with a lot of people, like people in nursing homes or people who work in restaurants, checkout lines, that kind of stuff.
Yeah, and I will say here in Congress, there's a mix of people who are wearing masks, and some are actually also wearing face shields too.
Thank you,
Thank
Keith,
you
for your question. Yeah. So our next question comes today from Dr. Fleischer, I believe, from Berwyn. Dr. Fleischer, you should be on the line now.
Hi there. Thank you for and a lot of this was already addressed by some of our speakers. Just with how we're doing with the contact tracing, and do we have any insight into the rates that the PA.gov, posts as far as not just the number of new cases, but the positivity rate and where the contact tracing is showing those are coming from? I heard that now that the nursing homes are going down, but is there any more granular information for residents to try and assess their risk out in the community?
Thanks, Dr. Fleischer. If Ms. Kastner could handle that, I would love that. Dr. Kastner, if you could handle that.
Be happy to. So we have on a weekly basis, we publish on the Chester County Health Department website, and you can go to chesco.org/coronavirus. There is a report we put out every Friday to align with the state's report, although our Chester County report adds a little bit more data just to kind of give the context of the specificity. The positivity rate. So what we are seeing in contact tracing is an increase in the number of contacts our individuals have been within the 6 feet parameter and greater than 15 minutes unmasked. So we are seeing more and more close contacts of individuals. And as we add to these numbers, the number of positive cases, the number of tests we do, the number of contacts per individual with a positive, our positivity is going to go up and down to reflect that. I think the biggest message around contact tracing, beyond that it's a strategy to help break the transmission, is the importance of people participating in it. So we are getting some refusals in the sense that we're not given the names and contact information for the close contacts, which prevents us from reaching out, quite frankly, and giving the appropriate guidance on quarantining, watching their symptoms, getting tested when they need to, etc. So I advocate that, you talk among your families and friends to really encourage, if it comes to that point where you are a close contact or a positive, that you do share your information. That's how we start to understand what our trends are in a greater level of detail. So I hope that was helpful.
That's very helpful.
Great.
And it's one thing that I do, if it's at all helpful to know, is I try to keep a daily, calendar of where I've been, because I think that that's helpful, just in case for some reason I end up in the situation where I'm asked, who I might have seen. I think it's useful to be able to have that information.
Thank you so much, Dr. Fleischer, for your question. Our next question comes from Gerald in Westchester. Gerald, you should be on the line.
Hello, Chrissy.
Hi, is this Gerald or Gerald?
Actually, I go by Jerry, so that'll be great.
Jerry. Hi, Jerry. Thanks for joining us.
Hi. Chrissy, given that the better mask should mean a greater decrease in coronavirus transmission, I have a question that has two parts to it. Part one, when will N95 masks stock be at a level to make them available to the general population, to include those at most risk and those people around those at most risk? And the second part is the Defense Act being used aggressively to produce maximum number of N95 masks for us citizens in the U.S.?
Sure. Thanks, Jerry, for your questions. And if it's okay, what I'll do is I'll take sort of the back part of your question from a legislative and policy perspective, and then maybe ask Ms. Kasner or the doctor to talk a little bit more about the efficacy of N95 masks as well. So you're right. There has been a lot going on to make sure that we have ample supplies of PPE, these masks included. Specifically, I was instrumental in help writing a bill called the COVID-19 Emergency Medical Supplies Enhancement Act of 2020, which is about, as you mentioned, using the Defense Production Act authorities to make sure that we can massively scale manufacturing and distribution of PPE. The fact is that this bill, interestingly enough, has actually passed the House not once, but twice, and as most recently as this week as part of the defense bill that we were just talking about. So we really can't take our eye off the ball with the importance of using the Defense Production Act to scale up our PPE manufacturing. The way that this bill particularly will work itself, I hope, through the system will be, now that it's passed again through the NDAA or the DoD part of the bill, it will then go to conference with the Senate side, who the Senate has also passed their NDAA, and hopefully it'll come out in the wash and be part of the law in the end. But you're right, we really have a challenge where we really need to be scaling up our production of not just these masks, but other essential parts of PPE. What I will say is I still worry that our medical infrastructure doesn't have enough PPE, let alone our citizenry. And one of the things that I remember hearing from Dr. Levine on one of our calls as a delegation with Pennsylvanians is we sort of anticipated that we, meaning the Northeast and those original hotspots like the Pacific Northwest, would get our, curve flattened, get things under control, and hopefully the remainder of the nation would also have, stayed where they were in terms of cases, and therefore we would have the ability to ramp up production of PPE over the course of what remains of the summer and into the early fall, so that when and if this comes back in force, as we anticipate that it would be, that we would have stockpiles of PPE. That unfortunately hasn't been the case because we've had such hot spots down in the South. A lot of the PPE production has understandably then been diverted down to those places where the disease is very active. And I worry that will mean that we will be behind yet again on PPE manufacturing and production. And therefore, to your question about when it might be available for citizens, may not be in the near future. But what I will do is ask the Dr. Abella if there is a necessity for us as common citizens to have an N95 mask, and what cases is that the case?
Yeah, it's an outstanding question, and it's definitely a question I get a lot. So perhaps it helps to start out what we do in hospitals. So it is general practice now to not wear N95 masks if you're a healthcare worker seeing patients, unless you're in the room with a known COVID positive patient who's actively coughing. That is to say, a higher risk situation. The evidence seems to suggest that N95s are somewhat better, modestly better at protecting us than regular masks. But what that means, if you're in relatively low-risk situations, outdoors perhaps, in the grocery store where you're sort of keeping your distance and there's no reason to presume anyone is really sick nearby, regular masks or cloth masks work almost just as well. And you hear me hedge a little bit because it is true that N95s are a little better. The problem is N95s are a lot more expensive, and N95s are a lot more uncomfortable. And if you have to understand that if it's more uncomfortable, you fidget with it a little bit more, and you might touch your face more, which might sort of reduce the efficacy of the mask. And N95s are a little tricky. They have to fit properly. Different sizes work for different people. So this is all to say we, as healthcare organizations, we really encourage cloth masks and regular sort of paper masks and think they're really, really close in their efficacy. That N95s are not really that essential for general public use. And through the use of cloth masks, as I mentioned earlier, we've seen very, very few healthcare worker infections. And these are people who are in patients' rooms all day long, many of whom are undiagnosed COVID patients. And we've seen almost no infections through really strict use of regular surgical masks, cloth masks, and not N95s.
Thank you, Doctor. And Ms. Kasner, do you have anything further to add to that conversation before we move to the next question?
No, it's been well covered between the two of you. Thank you.
Excellent, excellent. Connor, who is our next person?
All right, thank you, Jerry. Our next question comes from Beth in Kennett Square. Beth, you should be on the line now.
Oh, well, I guess my question, hello, Chrissy, is really maybe for the medical people, Janine or Dr. Bella, and that is I'm interested in whether or not they feel the flu shot that people like us in our 70s get in the fall is something advisable, or the fact that perhaps, like Dr. Bella said, there could be a vaccine in 6 months. Is that something we should go ahead and get, or will there be a complication? Will we even be able to get the normal flu shots this fall, and should we get them earlier, or should we just kind of wait it out a little bit and see if there is no complication with the vaccine coming out?
You guys want me to take this one?
Yes, please,
yes,
sir.
that'd be good.
Okay. Yeah, thank you for that question. Very important one. So we know that flu shots are really, really important, and we encourage people to get flu shots. There's some mythology out there that's important to spend a minute on, saying, oh, I can get the flu from the flu shot. It is certainly true that some people get a little inflammation with the flu shot and might feel a little unwell for a day. That is not the flu. You can't get the flu from the flu shot. They're very safe, and they're very effective. And it's important to remember that although the flu is a lot less dangerous than COVID, it's still a dangerous virus. And every year there's many people who actually die of the flu or require hospitalization. So I would encourage everyone to get the flu shot this fall. I'm not certainly a flu shot expert, but I've not heard any information to suggest that there won't be flu shots this fall as per normal. There's a whole system in place each year to sort of develop the appropriate flu shot for that year, and I'm sure they'll be available. And I think actually it may be more important to get the flu shot this year because we're going to have a tough time as a society and healthcare providers sorting out when someone appears with a fever and a cough, whether it's a cold, the flu, or COVID. And so we really want to stamp out as much flu as we can so that we can do our best to diagnose those with COVID. So I would encourage you, when flu shots become available, you should definitely get them. I don't think or suspect there would be any complication or overlap with any problems from COVID. It's been time-honored and shown to be a very, very safe and effective system to get annual flu shots.
Thanks, Doctor. And I from my perspective, from a federal, kind of legislative perspective, want to emphasize that here in Washington, I and my office have been working really hard to make sure that we're pushing for testing and for vaccine development, but also to make sure that when and if we get to that place where we have a viable vaccine, that we are ready with production and ready with distribution plans, because as we've seen, this is a very complex supply chain problem. Making sure that we have a product is only the first step in that. Making sure that we can manufacture it to scale is yet another step. And then as you've seen, the distribution of any form of product that's related to COVID has been complicated. So we're here in Washington trying to make sure that there is a plan and that there is also a rollout plan for how that is distributed, and also, frankly, really importantly, a PR plan as well, because we want to make sure that we're educating people to your question, ma'am, about, what's safe, what's not safe, who gets it, when do they get it. We want to make sure that we're providing the resources to be able to inform people about the efficacy of the vaccine and about how they get it as well. Thank you so much for your question. I think we have another question, Connor.
We do. Thank you, Beth. Our next question today comes from Dave in Westchester. Dave, you should be on the line now.
This question, I guess, is mostly for Chrissy. I've read and heard from various reputable news sources that the Trump administration has directed hospitals not to report their data to the CDC, as is normal, but to report them to HHS. And my concern is that how their tendency to try to skew reality to make certain people look better, that they're actually suppressing information, keeping it from the American people, and that whole free flow of information, I think it needs to be there. I know Fauci's been not invited to these press conferences, same deal. So I'm just wondering what is being done about this situation to suppress the authoritarian tendencies of this administration. That's my question.
I very much appreciate your question. It's an absolutely great question. I'm concerned about that too, specifically, and in fact just helped to write a letter to HHS saying that I and many others who were signatories on this letter are concerned about the politicization of data. We can't politicize science, as we've seen in the last 6 months. I think we are tragically behind in our combating this disease by politicizing something as simple as wearing a mask. And we really can't afford to kind of bury science and obfuscate. I am hopeful that letters like these will make a difference, and the reason why I say that they do is that my experience is that they have. Another example is you may have seen a recent news cycle where President Trump did not want to authorize students with green cards to be able to kind of come back or participate virtually in their schooling. There was a pretty big congressional pushback on that in the form of letters and other things, and effectively the administration did reverse course on that. So I'm hoping that enough uproar coming from Congress and other places will reverse course on this, I think, very poor decision. We really need to have clear visibility on what's going on. We really need to use the channels of information that have been established by experts on this as well. So I share your anxiety about that, and I'll continue to work to fight for my position to reverse course on that. Thank you so much for your question.
Thank you, Dave. So we have time, everyone, for one more question today. And just a reminder, there are still a number of questions in the queue. So for those questions that were unanswered, we have taken down your questions, and we will make sure that a staffer from Christy's office gets back to you within the next 48 hours. Our last question today comes from Jeff in Sinking Spring. Jeff, you should be on the line now, sir.
Hello. Thank you for taking my call.
Hi, Jeff.
As a small business owner and a CPA, I deal with 100 business clients a year. And the PPP program was awesome for a lot of my small business owners. But it's very frustrating as well. It seems like that I have numerous clients where it's the information that comes out is like at the 11th hour, and it's just Congress seems to be very, I don't know how to say it, but they're very reactive. They're not very forward thinking, and even with the forgiveness application, it seems like there's a lot of according to the American Institute of CPAs, there's some things that need clarification on, and even the banks are like, well, hold off, And what I worry about is, especially with tax season going to July 15th this year and the 24-week extension for the PPP, I'm wondering, are some of these things going to be addressed before, some of the questions going to be addressed before, like, we get to the end of the year, so the clients can go ahead and apply and get forgiveness for their loans?
Sure.
I mean, is there still, like, is there still dialogue, I guess, going back and forth, to get this resolved?
Absolutely, and I think you've got some really remarkably awesome questions that I'd love to give you as much clarity as I can from my purview. I sit in the Small Business Committee here in Congress, and of course the PPP program, kind of was birthed out of that on this side of the Capitol as well as on the other side. And you're right, I think it's been a good program, but I think you're absolutely right that just like every other part of our economy, the Congress is trying to do its best with kind of unprecedented situation, and we're trying in legislating things like the PPP and working in tandem with the Small Business Administration and the administration. You're right that there has been times when we need to be more clear as a Congress with our congressional intent, with the intent of the law. There have been times when the Small Business Administration has not necessarily performed appropriately in terms of transparency of data or the quickness with which they ramp up the program. And that's all, frankly, in some ways understandable. This is terribly unprecedented, but this has been quite a successful program. And you're right to identify some of the places where we need to work on. And I think we are working on that with this package that will be coming out. So specifically, the Small Business Committee here on the House side has been insistent with the administration that we need more transparency in data. We need to know where these loans have gone, how much has gone out, with what, how these loans have been spent. So if unfortunately we are in the situation where we need to do another tranche where people access this loan again, as an example, we need to understand how people were spending it. How did it work? Did it not work for them? So that we can modify the program and make it more effective. That's number one. Secondly, you brought up a really good point, which is about 85 or 86% of the loans that have been given out to date through PPP have actually been below $150,000 in value. They only represent a little bit less than 25% of the total dollars that have been given out, but there's such a huge number of the absolute number of loans that one of the things that I've put forward in legislation that I'm actually quite hopeful will make it through the next package is something called the Paycheck Protection Program Forgiveness Act. And effectively, the Paycheck Protection Program is forgivable. It's a forgivable loan if organizations follow the requirements that the government has laid out for them. But with these small-sized businesses, many of whom I think you probably work with, the administrative, difficulties of executing on that kind of demonstrating that you have effectively, followed the letter of the law can be hard on them. And it can also be hard on those folks who are administering the loans to make sure that they are, with 85% of the loans, following up on all of this paperwork. So this Forgiveness Act has to do with that 85% of the loans to make sure that it's easy for those small businesses to be able to represent how they've used the money. And it's easy, therefore, for the banks and lending institutions who've given it to them to be able to process that forgiveness so that they can focus more on the larger nuggets and also on, if we are in a situation where we're giving more PPP money out, on giving out more money. I can say that I was on a call on Friday, this past Friday, with Secretary Mnuchin. This was before the negotiations that have been going on earlier this week with the administration and the Senate side, where he did indicate a willingness to consider allowing people another dip, at PPP under certain circumstances, maybe lost revenue, maybe regional, that kind of thing. So it seems as though there is some conversation about that on the Senate side, and there obviously is conversation about it on the House side as well. So I am very hopeful that we will have, to your question and to your point, some effective modification of the PPP program, some additional opportunities for people to access it. The last thing I'll say is that there is also a bipartisan act that I'm supportive of. I'm a co-sponsor of, called the Restart Act. that is being knocked around in the House and the Senate side and possibly will be part of this next package. What it is focused on is on those industries that are particularly acutely affected by the fact that we can't get out and around the way that we used to. So live event spaces and restaurants, those kinds of businesses that are going to have necessarily a much longer road to recovery than other types of businesses are part of this Restart Act that I hope will be part of, again, of this larger bill that we're putting together. So I'm very glad to be able to lead the effort on the Paycheck Protection Program Forgiveness Act. It's not only bipartisan on the House side, but it's also got a companion bill on the Senate side. So I am very hopeful that will make it through this next round as well. But those are all awesome questions, and we are very much attentive to those concerns. And I'm very grateful to be able to be part of the Small Business Committee to think about those things. Thanks for your question.
All right, thank you, Jeff, for your question as well. And that, my ladies and gentlemen, does conclude our question and answer portion for today. As a last reminder, if we did not get to your question, a member of Chrissy's staff will contact you within the next 48 hours with an answer to your question. With that, Congresswoman, I'll hand it back to you to close this out.
Thanks, Connor, and thanks for everybody who joined the conversation. I hope that it was helpful and informative, and I very much thank our special guests for their expertise in lending us the information that they've provided us to make sure that we are factually moving through this world. I think that's really, really important. I also want to thank the dozens or so of my team who are on the line processing your questions, and we will be certainly getting back to those of you who we were not able to get to individually. So thank you very much for your questions, and we do take those to heart, and we also take them in terms of what we move forward with legislatively. The last thing I want to end with is same thing that Dr. Abella talked about, which is we are genuinely all in this together, and I'm enormously proud of our community and the Commonwealth for what I think has been a very, very strong response. But we are not out of this yet, and we need to stay vigilant. We need to stay respectful and responsible to our fellow citizens. I wear a mask for you. You wear a mask for me. You know, we practice social distancing because we care about each other, and because, frankly, it allows us to get back to our lives that much more quickly. So if we can just hold tight and hold strong as we have been by washing our hands, you know, with soap and water or with sanitizer, as we talked about, by trying to avoid touching our eyes and nose, to practice social distancing, to wear a mask. If we can do all of those things with vigilance, I think that we have a chance for Pennsylvania to be a shining beacon of an example of how we manage this disease. And the last thing I'll say is, please, if you, for whatever reason, are experiencing, you know, sadness or depression or just feeling lonely, there are also resources available for that. This is a very, very, very difficult time. My website at houlihan.house.gov has a lot of resources for you if you're experiencing that kind of pain in this time. And please know that you are really not alone in that. This is a very, very difficult time for all of us, and we very much would like to be helpful in providing you resources for that as well. Thanks very much for joining our call, and with that, at the hour, we will let you go. Thanks so much.